Macular degeneration is a condition that slowly robs millions of people of their central vision, often without pain or obvious early symptoms. Among the two main types, dry macular degeneration is far more common, accounting for nearly 90% of cases. Yet it remains largely misunderstood, underestimated, and undiagnosed until it has already begun to reshape lives. Unlike infections or acute injuries that cause noticeable, immediate damage, this condition progresses gradually, often in silence. The person affected may first notice slight blurring while reading, trouble recognizing faces, or difficulty seeing in low light. Over time, these subtle challenges grow into more disruptive limitations. At the core of this condition is the macula, a small but powerful part of the retina responsible for sharp central vision. It's what allows a person to drive, read, see fine details, and distinguish facial expressions. When the macula begins to deteriorate, the world loses its clarity at the center. Dry macular degeneration is marked by the thinning of the macula and the accumulation of small yellow deposits beneath the retina, called drusen. These deposits, while seemingly harmless at first, interfere with the retinal cell's ability to function properly. As they build up, the macular tissue gradually wastes away, resulting in irreversible vision loss. The causes of this condition are multifactorial. Age is the biggest risk factor, which is why it's sometimes called age-related macular degeneration. Genetics also play a role, especially among individuals with a family history of vision problems. But lifestyle factors are increasingly seen as contributors. Smoking significantly raises the risk. Diets low in antioxidants and omega-3 fatty acids can make the eyes more vulnerable. Uncontrolled hypertension, obesity, and excessive sun exposure also seem to contribute to the breakdown of macular health over time. This makes prevention and early detection all the more important, because while there's no cure, certain strategies can help slow progression. One of the troubling things about dry macular degeneration is that it often goes unnoticed in its early stages. The human brain is remarkably good at filling in visual gaps, especially when one eye remains stronger than the other. A person might compensate for a blurry spot or assume they just need new glasses. Eye strain may be blamed on screen time or aging, when in reality, degeneration is taking place beneath the surface. Regular eye exams, especially after the age of 50, are essential. During these visits, eye care professionals can spot drusen deposits or thinning of the retina before symptoms become obvious to the patient. Treatment options are limited, but progress is being made. While there is no medication that can reverse dry macular degeneration, certain nutritional supplements have shown promise in slowing its progression. The age-related eye disease study, ARDS and ARDS-2, identified a formula containing vitamins C and E, zinc, copper, lutein, and zeaxanthin that may help people with intermediate or advanced stages. These supplements are not cures, but they offer a way to protect the remaining vision. Researchers are also exploring regenerative therapies, including stem cells and gene-based treatments, though these remain in experimental stages. Aside from supplements, lifestyle changes can make a meaningful difference. A diet rich in leafy greens, colorful fruits, and cold water fish supports overall eye health. Wearing sunglasses to block harmful ultraviolet rays and quitting smoking are both protective strategies. Regular physical activity and blood pressure control also benefit retinal function. These changes are not just about vision, they contribute to cardiovascular and neurological health as well. The eyes, after all, are closely linked to the brain, and conditions affecting blood vessels or nerves often affect the retina too. One of the emotional burdens of dry macular degeneration is the loss of independence. Central vision is critical for everyday tasks like reading, cooking, driving, and recognizing people. As it declines, many individuals find themselves unable to perform these tasks safely. This loss can lead to isolation, frustration, and even depression. Assistive technologies, such as magnifying devices, talking books, and screen readers, can help bridge the gap. Low vision specialists can tailor interventions to an individual's remaining visual abilities, helping them maintain function and dignity. There is also the social aspect to consider. Many people feel hesitant to speak about their vision loss or may downplay it out of fear or embarrassment. Raising awareness can help families understand the challenges faced by those with macular degeneration. It also creates a more supportive environment for early diagnosis, proactive care, and emotional resilience. Communities can be educated on how to accommodate and support people with vision impairments in public spaces, workplaces, and homes. Vision is often taken for granted until it begins to fade. Dry macular degeneration is not dramatic in its onset, but it is relentless in its impact. That's why education, prevention, and early intervention matter so much. For those at risk, knowledge is power. Knowing what signs to watch for, understanding the value of eye exams, and being proactive with diet and lifestyle can mean the difference between maintained independence and life-altering vision loss. As science continues to search for better treatments, individuals today can take meaningful steps to protect what they see. The goal is not just to preserve sight, but to preserve quality of life. Seeing loved ones clearly, reading a favorite book, enjoying the beauty of a sunset, these are not small things. They are foundational to how people experience the world. And while dry macular degeneration may take some of that away, awareness and action can preserve much of it for longer. In a world of aging populations and increasing screen exposure, now is the time to take macular health seriously. Not tomorrow, not after vision begins to fade, but now, when the light is still strong.